Welcome back to the Faculty Factory podcast, friends. It's Kim Skorupski here at the University of Texas Medical Branch in Galveston, Texas. With me today, Dr. David J. Skorton, President and CEO of the AAMC, the Association of American Medical Colleges. How do you deal with adversity and stress? In your position, I imagine there are a lot of people who are stressed out, burned out. Their priorities are not your priorities. You're dealing with some of the most complex institutions in the world, academic health systems. When you have all that noise and all that chaos and buzz and all those strong headwinds coming at you, how do you personally quiet that or turn that volume down and remind yourself of your values and what you're bringing to the table? How do you do it?
Well, I don't always do it well. And please, to state the obvious, I don't run any of those institutions. I represent them.
Yeah.
I learn from them. When I need to understand what's happening in American academic medicine or elsewhere, I go to the source and ask the dean, the CEO of the health system, the faculty member, the student, the resident. So no illusions and no false modesty meant at all that I and the AAMC, we don't run the organizations. We represent them, and we take great ideas from one and let everybody else know about it in case it's applicable. Something happening in Galveston may be applicable to something happening in Omaha or Boston or, gosh, even Washington, if you can imagine. So in terms of how to get by emotionally with these things, it can be really, really hard sometimes. The headwinds that come can be of many types. You could have personal headwinds, illness, family illness, stresses. You could have headwinds related to the complexities of the actual job itself. So, for example, this morning earlier, I was reading another article about rural healthcare and the challenges that we have. And when I was in Iowa for a quarter of a century, there were many rural areas there. Not as thin population density as in some parts of the country, but rural health is a real challenge. And so I was reading about that from people who are living that. I'm not living it, and learning about the headwinds that they face. And so there's something there in learning and having a chance to interact with those folks who say, we're having headwinds, and perhaps you, David, could be doing more to focus on rural health or whatever it might be. And then I'm glad to say publicly that I've had a couple of points in my life, rough spots in the road, where I've had counseling, and it's been enormously helpful. And one of my heroes in that regard is my wonderful predecessor, Daryl Kirch, a famous academic psychiatrist, who in 2021 published in our journal, Academic Medicine, a very moving piece about his own lifelong struggles with mental health challenges. And so I'm a big believer in asking for help when you need it, from wherever that help might come. I'm a religious person. That helps. I meditate. That helps. And counselors, therapists help as well. So I try to be honest with myself, look in the mirror and say, what is it that you should be thinking about right now? And again, I don't know if this is so much a leadership discussion, Kim, as just, one human talking to another. I think the more we can accept ourselves the way we are and not pretend that we're going to hit some perfection idea that I think is very seldom achieved, if ever, I think the better chance that we can get through the day in a peaceful way and enjoy as much of it as possible. Not every day is like that. There's a lot of uncertainty in the country right now in education. My job is to make it work, is to work with whoever I can work with to make it work. For whom? For the patients, for the communities, for the students, for the residents. And so I'm endlessly optimistic, always looking forward, but thinking very much that there's many ways we need to take care of ourselves if we're going to do anything for anybody else.
Listen, everybody, you are in for a real treat because on today's episode, one of my most favorite people at Johns Hopkins, Dr. Fawaz Al-Ammary. Fawaz, good morning.
Good morning, Kim. It's always nice to be with you. Thank you so much for this conversation.
Well, okay. So I'm so excited. I just cannot wait to get into this conversation. And again, turn up the volume, settle in. This is going to be a great, great story. Dr. Fawaz, will you please start by telling everybody who you are here at Hopkins and what you do?
Sure. I am a kidney transplant physician and health services researcher. I do see patient, outpatient clinic, inpatient. I do consult in the medicine department, nephrology division, and I do research, and my focus in increasing living kidney donation in the United States.
Well, there you go. There you have it. Dr. Ammary, will you please begin by sharing this very, very important story?
Sure. So this story, I will tell you, Kim, and the audience with mixed feeling, really. But I think the point I want to really let people know that what the take-home message is really, I want you to stay positive, no matter what, and even if, and you can fill the blank, your story in your life. So I just can tell you, I was visiting my children in Denver, Colorado, and I met with my children on Saturday, and we had nice time. And then we had the plan for the next day morning to have breakfast together on Sunday for the Father's Day. So my children left, and I stayed at the hotel in Denver, and my friend came pick me up around like 7:30 p.m. We went to a restaurant in a very fancy area in Denver called Cherry Creek. And we stayed in a nice restaurant in the patio outside. It was so beautiful weather, nice. People are very peaceful. And we finished eating and we paid the bill and we just had conversation. I was talking to my mom by phone and then I hung up and just were gonna leave. And suddenly I heard something so strong, like a bomb hit my face. I have no idea what happened. And I lost my vision for about 30 seconds, but thanks God, I was still conscious. And I heard people saying, come after him, call the police. I have no idea what's going on. So, and people told me, come to the floor. So I took myself from the chair to the floor and my vision came back and I saw like a lot of gush blood coming from my face. So I kept pressure on my right side of the face to hold the blood coming out. And I hear people going on, things happen. I have no idea what happened, honestly. But the good thing, I stayed calm and I just say, I hear people, I just said, what is my friend? I was worried about my friend, what happened to him, because he was sitting in front of me. And they told me, your friend is fine. You were just trying to run after the guy who hit you. So it sounds somebody hit me. I have no idea what happened. Anyway, and the ambulance came and they took me to the ambulance and they told me, we'll take you to Denver County Hospital. I told them, could you please go to University of Colorado, because I used to be faculty there and I know everyone. Oh. So and the nurse was so kind. He said, "You're a doctor." I said, "You know what? We'll just follow your recommendation. Although it's going to be double the trip, but that's fine." So I was happy they took me to University of Colorado. Now, until that point, I just heard somebody hit me, and that's it. I have no idea what happened. I'm so grateful that at the University Hospital, I got really great care from neurosurgery, trauma surgery, ophthalmic, ENT. I had severe injury in my above my right bra, and I had also non-traumatic injury of my right eye that caused optic neuropathy. Now, thanks God, they did all the CAT scan, all the images. My brain was not touched at all. So my brain had no injury. I got a lot of maxillofacial fracture and nasal fracture only. So, and of course, there was like busy night and I had some symptoms at that time, but despite all of that, I didn't have, what's interesting that I didn't feel pain. And the doctor keeps telling me, do you need narcotic? Do you need pain medicine? I said, I don't feel pain. They told me, well, you're probably going to have pain, severe pain from the injury. I said, well, if the pain happened, I will ask you for pain control. So then my friend, came, and then I told him, what happened? He told me, well, what happened, we were sitting, and there was a guy coming from my behind, walking toward us. He was wearing like a shirt, Grubhub sign, and has a red banda. And he was carrying like a big bottle of wine, like black wine glass, big bottle basically. And my friend told me he looks suspicious, but I thought he just, making a delivery or something. When the guy came near our table, he just hit my face and run away. And there was a truck waiting for him across the street, and he jumped in the truck and he ran away. My friend tried to catch him, but he couldn't. There was another guy who ran after the truck, took the picture, and they got the information. Unfortunately, all the information, the police did the investigation. The truck was toasted, and they left no fingerprint. So they were very clever how they did it. But the good news that out of this, that I was doing well and I was alive. So what was concerning me at that time, I promised my children I'm going to see them next morning to have breakfast together, and the recommendation was to stay in the hospital for observation. So I told, I met with all the surgeons. I said, if you feel you do something, do it. And I got all this more than 20 stitches above my eye, and they did a great job, really, like plastic surgeon did it. And they told me, listen, Dr. Ammary, if you want to leave, it's fine, to meet your kids, have nice breakfast with them, and come back after. So I said, great. And again, they were so worried that I have to have pain medicine. And they said, we're going to prescribe with some pain medicine. There's no way you're going to have no pain. I said, that's fine. You can prescribe whatever you want. I'll use it if I need it. Thanks God. I told my parents, again, all this happened. I didn't feel pain, Kim, whatsoever. Like it was just like normal pressure, but really no pain. So it was, I was very thankful to God. And then what made it really exciting to me and happy when I saw the kids next day. So I went to the hotel and I met the kids at the restaurant where we promised the plan. And the kids were shocked when they saw me because I was covering my wound with all this bandage, and I put my sunglasses so they don't see the bad thing. And my kids were wondering, what happened, Baba? I said, let's have fun. Baba is here, and let's have fun and play together and eat breakfast together. Somebody hit me, but I'm fine. That's the important thing. And we spent a good day, really. And that really what was happening during that injury. My parents keep calling me. I didn't answer my phone, of course, because if my mom saw me, she would be, of course, not feeling well. I also am thankful because my mom was supposed to be with me that visit. And I told mom, don't come with me that visit for some reason. Just like I said, I was just going to go for 2 days and come back to Baltimore. So it's not worth it, the trip. So I was also grateful that my mom was not involved and my children was not involved in that injury. Then I came to Baltimore. I'm also thankful to John Hopkins, plastic and ENT surgeon. I got like a constructive surgery for nasal septal fracture. And I'm really doing great. I was taken care by our ophthalmologist here at Hopkins and did a great job. I'm recovering, I think, almost close to 100%. And one of the things was raised to me, Dr. Ammary, we were worried about mentally impact of the injury and how you're going to feel about this. And then I sat back, I said, let me tell you something here. If I was going to do one good to the public, now I'm going to do 10 goods. I'm grateful, I'm thankful to God, what happened to me, and for the support I got from people. Kim, you cannot imagine. I got so many messages from the nurses, from physicians, from the staff, from patients. I was like, it just was amazing. I got messages from people like I don't know them. So I was really felt like so appreciated at what people doing. And it just teach me like really a lesson that how to be respectful to other people and kind, no matter what, their race, their color, their religion, their tongue, whatever their background. We should really work together and judge people by their action and give them room. If people make a mistake, give them room. And I remember this lady. We were one day, like we were walking in a very crowded hall, and this lady said, "Listen, guys, there is room for everyone. So everyone has room. Don't feel that somebody will take your bite. Or I mean, there is room for everyone. We just have to work together." So really, I mean, this is what I was going to tell you, Kim. I mean, I think this what happened to me is inspire me in a positive way how to give back to the society. The life I have now, I have just to pay back. Honestly, God gave me second life. So, and I hope I will meet people expectation and God, trust that I will do well and positive to the community.
Everybody has a story, and many times we don't know each other's stories. And that grace and that mercy that you talked about of just pause a minute and give people some love and understanding and kindness. I just think you're amazing. And on today's episode, I'm really happy to introduce to you my friend and colleague, Dr. Barbara Fibush. Barbara is our Senior Associate Dean of Women here at Hopkins and the director of the entire Office of Women in Science and Medicine that she started. Barbara started her career in pediatrics. In fact, she's a professor of pediatrics, and she even developed and started the division of pediatric nephrology.
I think the importance of being resilient can't be overlooked. I think people have to be focused and really open to the idea that it's not always good and it's not always easy, but that they can persevere and they can get through it. And working on your career it's a long-term process. And I've heard members of the team talk about it being a marathon, not a sprint. And I guess I would just urge women faculty and really all faculty to think of it that way, that it's really a long haul and they just need to stay strong throughout. And there are going to be better years and worse years. And I think, again, last year and now are times that are very tough for faculty. So just stay focused and strong as best you can during these difficult times, because there are going to be ups and downs of your career. When we look at our individual strengths, there are some people that are stronger at building collaborations and building bridges, and some people who it's less natural for. But I think for success in an academic institution, it's something you have to work on. So I think that you learn as you go through it. I think you have to assume that there are going to be many people that agree with your position and many people that don't. So the building of teams is to find as best you can like-minded people who are working in the same direction and create a group that has that energy that you had. But at the same time, you have to involve those people who don't agree with you so you can really understand the barriers and obstacles to your project and to your purpose. And I think with a combination of surrounding yourself with people that can really show you where you're going to have a problem, and then people that are enthusiastically supportive of you, allows you to make progress in this arena. I don't think that every project that you propose or you want to work will work, but I think you have to be able to look at a bigger picture and feel like I'm moving forward. The needle is moving. My foot is on the accelerator. It's going very slowly. Progress is slow. Getting projects approved, programs started, they take determination and consistency, and I guess partly stubbornness. I think you just have to keep pushing when you feel that you're moving in a good position, but you also have to be able to identify when it's not the right time and it's not the right program, and you have to just push back from it. So I feel my work with women has really taught me that there are lots of opportunities and lots of doors that can swing open, that surrounding myself by both like-minded women in academic medicine and other colleagues, and also by being aware of those that don't always agree with me, allowed me to build teams that could listen and formulate plans that were finally or ultimately approved and put in place. I would just hope that people listening to this podcast would understand, and I think we see it so clearly in many aspects of our life, that collaborations are necessary for success, that building teams and working with others is necessary for success. People feel that they individually can have personal discovery, and I think they do when they can, but a long-term successful career involves really being able to work with other people, garnering their support, and then supporting them back. I think it's a critical part of a career in academic medicine is to have these collaborations and networks. When I look at the most satisfied academic scientists, physicians, it's those people that have these large networks that really have people that they can work with and know that they're working in the same direction. And surprisingly, you have to reach out to people, but there are many people where you are that probably can help you, can assist you. Again, it's important to include those that don't think as you do not have personalities that you have, to give you a broader scope and grasp of your culture, of the environment you're dealing with. But I think learning to do it together, it is much more important, and you will be more successful than trying to do everything by yourself. It's impossible.
Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.